Now we're going to kind of meet the winning companies. About 90 seconds each for them to introduce themselves, what problem they're solving, how they're solving it, what are some of their accomplishments to date. I'll try and ask a smart question to follow on.
Hello, everyone. I'm Lindsay Watson. I'm the co-founder and CEO of Augment Therapy. What we do, in short, is we make movement fun. But more importantly, I have spent the last 20 years as a physical therapist working primarily in pediatrics. And the problems we're solving are problems that I actually felt in my own practice, which was really struggling to engage kids in the therapeutic exercises that they needed to do to get better. I wanted to improve the experience for my patients, but also for me as a provider. And so, what our software does is we basically combine computer vision, accessible through your phone, tablet, or laptop through your web camera, and we combine that with augmented reality. So we layer digital content and characters over your reflected image on the screen, and we capture objective data on your movement and couple that with virtual care enabled features. So we can leverage our solution to be used in the home. You can use it in the clinical setting, in outpatient. So we truly enable a more accessible and engaging experience for rehab. And this is a vast problem affecting 1 in 6 children in the US right now have a developmental disability. They often land in physical therapy or occupational therapy, and they usually hate the experience. So we improve that through characters like those in Sesame Street. You can actually exercise alongside Cookie Monster and Elmo. And I can assure you the exercises are much more fun when Cookie Monster is guiding you to perform them. So that's what we do.
Fantastic. I love gamifying and making media part of our medicine, essentially. Back to that personalization, like my kids love Pokemon. Can you sort of pick your character and hone that? And are you using AI and other layers to hyper personalize your interactions?
Right now, the partnerships that we have are with Sesame Street. We have another one in the works that we're hoping to announce soon, but we have other unfamiliar characters that your kids can actually select and customize. They can represent themselves, they can act as trainers on the screen. So there is customization and personalization within the software, but hopefully we grab some more partnerships to make it so that you could truly select your favorite characters.
As we know, again, I'm trained in pediatrics and in general medicine, but we've also seen a dearth of solutions in the pediatric space where they don't get adopted or paid for, just like in the challenges across the adult world. What lessons have you learned that are unique to getting solutions out into the kids space, whether it's a pediatrician, physical therapy, and beyond? Any kind of quick lessons or insights?
For us in the physical therapy space, what's been challenging is there are existing codes that our software can be billable under when you're using our solution in the clinical space with the physical therapist present. It's difficult then to speak to the clinician about the value of our tool when they could use a ball as an augmentative tool in that therapy session versus using this digital solution. Well, what's been great is there are these new remote therapeutic monitoring codes, which are relatively new. But one of the challenges we've had is educating the therapy community about access to these codes and using them in their practice. By and large, in the rehab space, for example, we have a huge problem with adherence. Less than 30% of our patients adhere to the exercises we prescribe outside of our one on one clinical practice. And those remote therapeutic monitoring codes enable providers to bill for the time they spend applying the technology, monitoring the data from it. And then these patients are empowered by the fact that they know those providers are watching the data around their performance. And so it's a win-win, but it's challenging to educate the community about these codes and billing them for the services that they're using, like augment therapy.